my topic is conversations that heal. So I'm going to focus more on what are the conversations on narratives that come up in therapy and how we can address them. We can go to the next one. So I think we need to understand shame as such. I think the earlier speaker really went into depth about, what are all the changes and the personality makeup of person who feels the shame at a very early age and how it develops. But what I would like to focus on is shame is a self-conscious emotion for all of us, and usually with a negative evaluation. And it's an universal emotion. All of us have felt it at some time or the other. For example, when we are talking in a social context, sometimes we make faux pas. All of us do that. And then we bite our tongues. And that's so common. Or we have forgotten a dear friend's birthday and we forgot to wish them. So we feel bad about that. And we feel ashamed that what kind of a friend am I? So these are common things that happen every day. But I think what we are going to discuss today is a little at a deeper level, how it can affect the mental health of a person. So it's at a much more deeper level. So what happens with shame is that the negative scorn from others, tends to get deeper into you and you start internalizing it. And that's what causes the harm. So self feels under an onslaught of criticism. And especially if this happens early in life, you have these fixed notions about yourself, like I'm flawed, I'm inadequate, or I'm a fake. So these things just stay with you. So whatever you're approaching feeling that sense of self as flawed, as somebody incompetent. And I think we need to understand that shame has an evolutionary function in the sense that I think when people started living in groups and communities, they needed to keep the group together, the community together, and they would have some group norms. And when a person did not follow those group norms, he was made to feel shame. He or she was made to feel shame or guilty about what they did. But this was more kind of adaptive shame, because once you corrected your mistake and the community accepted you back, you belong to that, then the shame is no longer there. So biologically also, we seem to be hardwired to shame because of this evolutionary function. Next slide, please. So we need to distinguish between two kinds of shame. That is, one is adaptive, like I just told you, what allows you to make a mistake and be guided to correct it and then accept it. Then it doesn't become a deep-rooted, harmful kind of shame. Whereas the trait shame, if we can call it a trait shame, which is deep-rooted, I think which the earlier speakers spoke eloquently about, it develops early in life based on how we are treated by significant others. And we start internalizing these statements made by them. When there is a holding environment, for example, like I said earlier, if there is a acceptance of our mistake and then correction, a corrective experience after that, probably it doesn't become a trait, because whatever mistake happened and you corrected and you got accepted. At the heart of shame is always this need to be accepted, need to be loved. I think that's so universal, and it's very much at the heart of shame. That's what I believe. So the distinction between guilt and shame, I think we need to make a small distinction here, though they get overlapped very often. So when I feel guilty about a mistake I made, I try to correct it. I try to tell myself that this is a mistake and I need to change. But when I feel ashamed, it's a onslaught on myself. I say I am a mistake. So there's no question of correction. I'm done. I'm just that. I am just a mistake. So I start identifying totally with whatever my weaknesses are, or I over identify with that. So some examples to talk about. So let's say an adolescent who is labeled lazy and irresponsible because he's poor in studies. The reason may be because he's finding it difficult to cope with studies, and he feels if he tries more, he might fail. So may as well, not attempt. While the world around him, the teachers or the parents, everyone is going to label him as lazy and irresponsible. Similarly, a lady, in fact, I had this client who came with the complaints of feeling like a bad mother and a bad wife. Mainly because she felt that her husband, who had an alcohol issue, would come home late, and he expected her to be on his, at his service, trying to heat the food when he comes late, and this would lead to an argument. And the children would wake up and they would say, since you are more self-aware, why can't you adjust, and why can't you just give him what he wants? So this, somehow the children also seem to, which is very unusual. It happened in her case, but to the outside world, she was actually a professor, highly recognized academician in a college, and very successful at that. But at home, this was what was happening. So she could never look at herself as someone worthwhile in any way. So shame can hold us under its grip, causing over identification. So once we have had this experience, once we have felt hurt or badly damaged because of criticism, of harsh criticism, we tend to over identify with that. And we we become self-absorbed. I mean, there's a lot of rumination about, how I'm this and how I'm not able to, do my best in anything I try. I seem to show my incompetence. I'm not good enough, and so on. And therefore, we start isolating ourselves as well. So all these are certain signs of how a person who feels shameful goes through. Sometimes the shame can be a cause of a variety of mental health issues. I mean, the whole range of it, with the anxiety, depression, substance use, and so on. Or sometimes the impact of shame can cause a mental health condition. It could be either way. So we need to keep this in mind, how shame can be very harmful. Can we go to the next one? So now I'm going to present a few narratives of my clients, which will give you an idea about how we can understand this better. Can I go to the next slide? We finished this. Yes. So this was one of my cases. So Dr. Pallavi, name changed, of course. She was referred to me by a psychiatrist for depression. That was precipitated because of a medical legal case that had been filed against her. Her self-esteem was totally shattered after this case. Just 1 minute. What is wrong with you, Mila? What is wrong with you? I'm sorry. So Dr. Pallavi, she came to me. She was a well-recognized pulmonologist working in a private hospital. And it happened that she was in the outpatient one day, and a patient came who was not her patient. He had undergone orthopedic surgery few days ago, and after that, after a few days, he had developed some fever, and he came for the fever. So since the orthopedician was not available at that time, she was forced to see this person, and she examined him and gave him some symptomatic treatment for his fever. But she told him very clearly that since you've had surgery just a few days ago, you need to take care and make sure that you meet your own doctor because certain investigations may be necessary. But this person didn't come back after 2 days, and after a week, they got the news that he had died. And that was, of course, shocking. He was just 30 years old, and he had a young child, and he was the only son. And so the father of this patient became, the grief was so much that it turned into revenge and anger. And he just came and he just shouted at Dr. Pallavi in front of everyone, saying that you killed my son. It's because of you that he's no more. And all these harsh statements were made. After this, she was so shattered that she just couldn't trust her professional judgment. She was deeply shameful and didn't want to face the world. She didn't want to face any of her peers. Very understandable. She had been so successful and suddenly this happens to her. And even the medical council did not support her, unfortunately. So she had to give up on her practice for a year. So she was feeling so guilty that then she went and consulted many of her senior pulmonologists in the city to ask them whether what she did was wrong and where did she go wrong. But they all validated her, saying that if we were in your shoes, we would have done the same thing. She avoided doing any um, invasive procedures or investigations on that case because first, he was not her case. Secondly, he was just recovering from the surgery, so she didn't want to do anything invasive. And she thought her doctor would be the first best person to decide on that. So that became her fault. And all her seniors told her, in fact, she did a post-graduation in the US. So she even went to US to clarify with her professors what she did was wrong, right? So you can understand the anguish that this person was going through. And this painful experience also had a long history to it, in the sense this experience, in fact, reinforced what she had believed to some extent deeply about herself. So as she was growing up, she was always good in her academics, and she had a sister who was a very hardworking person. So both of them were good, but the sister would, burn the midnight oil and work hard and get her marks, while Pallavi could get it, reading last minute. And the parents always told her, I think you're just lucky that you managed to, excel, but your sister actually does the good work. So this stayed with her, and she always felt that she was a fake. She was not really knowing things, but it looked like she was lucky to have, her marks or scoring marks and things like that. So her narrative was, my qualifications don't mean that I'm competent. It was just a matter of luck that I would complete my post-graduation. I am hollow inside. I am a fake. So typically an imposter kind of uh, feeling. So that was her narrative. Next slide. So I have narratives from different contexts. So this was one context. This is another context where Miss M, she was 20 years. So she was referred to me for depression and panic attacks. And both parents were distinguished professionals in their own field. Father was a IAC professor, and mother was attached to an international organization. She had a PhD in international studies. So both of them were very well recognized. And this put tremendous pressure on M uh, right from school days. And she couldn't perform because she would feel so anxious that she couldn't do what she knew well. And this affected her, traumatized her. And in fact, the parents used to be called as chief guests in the school for the various functions. So the teachers would always point out to her that you have such bright and intelligent parents. How can you be so bad? It was not just the teachers who would all the time compare her with parents, but also since she was a timid girl, a little introverted, therefore there was a lot of bullying by the peers. And to have the icing on the cake, there, there was child sexual abuse as well by a teacher in school. So all this had completely made her feel that she is so damaged and she is so shattered and carrying this burden of shame all the time. So, in fact, even during therapy, in the initial phases, she wouldn't even make eye contact because she felt that others could see through her, that she was not okay. So, this was what she was going through and feeling completely crushed under the burden of shame. Her narrative was that bad things happen to me because I am damaged. I am flawed. So that is how she felt. This was the narrative. Next one, please. So the picture you see on the screen is of Hasina. She was introduced to me, in fact, referred to me by Dr. Shekhar Sheshadri, who is the speaker, next speaker. He referred the case to me, and she was an acid victim who was being, her treatment was being sponsored by the Claire fashion magazine. And this picture that you see is an article which had come in Claire some time ago, of course, with me and her, and she's gifting me her needle craft. Anyway, to come back to Hasina, she had lost her eyesight and disfigured her face, and she needed 28 surgeries. And I'm glad that Claire Fashion Magazine sponsored that treatment for her. So the impact that all this had on her, that she just wanted to hide herself from the world. She would put the veil on her face and she would not show her face to anyone. She thought it was frightening and she couldn't show it to others. But what had actually happened was that Hasina came from a very Orthodox Muslim family. And after her graduation, she wanted to go and earn her living. She wanted to start working, but her father had opposed her, saying that, girls don't go out and work. It's men who have to go out and work. So, but she insisted and she was stubborn and she got a job in a private firm and she started going there. And one of her colleagues, she was really Hasina at that time. She was beautiful. I've seen the pictures before and they were completely, anyone would get attracted to her. So there was this colleague who was interested in her, who started following her. And she made it very clear to him that she cannot get involved in any sort of thing because her family was completely against it. So she told him to get away, but he did not listen. He continued. She complained to the boss saying he's following me, but boss didn't do anything about it. And finally, When she went on rejecting, one day he just threw acid at her. And of course, he was caught and put in prison. But I mean, what she had to go through was a lifelong anguish of, all this. So more than what she felt through this, one was in therapy, how to get her to just allow herself to be seen, accepting that, yes, this disfigurement has happened, but I am still valuable. So getting to that narrative, it took a long time, but it did happen in the end. More than that, I think what she suffered from was that the shame that she felt due to the moral accusation by her father. So her father would never believe that she had not done anything to encourage this man. He always felt, you must have done something, and that's why he did this to you. So he would not believe her, and he would not come for therapy when I asked him to come. And finally, I had to visit the house and convince him that it's important that Hasina believes that, you trust her and her character is not a bad character. So I had to go there and then bring him back to therapy. He started coming to therapy, and that's how it all happened. So you can see the stereotypical patriarchy and the gender discrimination, which was at its worst in her case. So I will come to her therapy a little later, just giving you narrations of others. Can we have the next slide? Yeah, this is about a narrative from a marginalized group, sexual minority. So Mr. M, aged 19 years, he was an engineering student, felt attracted to one of his lecturers, and the lecturer encouraged him to have a friendship with him. He would meet him outside and so on, and confide in him. And once M came out with his gay identity, the lecturer showed complete reversal in attitude. Like he would just shun his company, and he made it very clear that you are, you are a freak, you are not okay, and I don't want to have anything to do with you, and so on. Mr. M, who was a bright student earlier, became disinterested in studies, and he had disturbed sleep and suicidal thoughts. So the parents brought him for therapy to be converted to be a normal heterosexual. So the client suffered from intense guilt and shame about his sexual identity, which was triggering the suicidal ideation. So he felt that he cannot affirm himself at all. He has to, he's a freak, and I am unfit to be in this society. And that was his narrative. The next one. Next slide. So how can, what should be the focus in therapy? How can we help people who are carrying this burden of shame? I think the most important thing is that the self-sabotage has to be converted to self-compassion. So the narrative of self-sabotage has to get converted to self-compassion. And self-compassion can be an antidote to shame. And I'm sure many of you therapists here are familiar with Kristin Neff's work on self-compassion. And her research showed that 68% of people are more compassionate to others than to themselves. And she defines self-compassion as treating oneself with the same understanding, care, and kindness that one would show when a dear friend is facing a failure, inadequacy, or personal loss. So she developed a scale to measure self-compassion and found that people who scored higher on it were emotionally more resilient, less self-absorbed, were healthier, and had better relationships. So she describes self-compassion with three components. One is the mindfulness. So what she means here by mindfulness is holding oneself holding one's experience in a balanced awareness, being aware of the painful feeling without over identifying it with or suppressing it totally. So, having that balance of knowing and at the same time not suppressing, not being judgmental. So, that mindfulness. Then she also talks about self kindness. So, having this caring and understanding towards self while you're suffering, while you're having that suffering. And finally, what she calls common humanity is recognizing that suffering, failure, and imperfections are shared human experience. Everyone goes through them, and we are not alone in the pain. So basically, like I said before, the heart of self-compassion, the heart of shame is wanting to be loved, wanting to be accepted. So this common humanity, the concept also allows you to connect with others in some form. Can we go to the next one? So how do we operationalize self-compassion? How do we... So the therapist has to gradually train the client to be her or his own therapist. What do I mean by this is that I think usually the therapist empathizes and tries to uh, compassionately look at the client without judgment. But here we have to prepare the client himself, to look at themselves with kindness, with compassion, so that they can overcome this shame and its effect. So the most important thing there would be to demonstrate self-compassion. And I think this has to come from deep within you as a therapist. I think it cannot be really learned. I think it has to be felt and practiced, and then it becomes a part of you. So therapist demonstrates self-compassion in her attitude, tone of voice, in her presence, and normalizes imperfections. What I mean by this is as therapists, I think we also make mistakes. So we might focus on one aspect versus the other. For example, even in Dr. Pallavi's case, I felt that I was focusing too much on the present context where she was feeling ashamed due to the case. But actually, it came from deep within, from her childhood, where she felt like an imposter. So then I realized at some point of time that I had to go deeper. And so I told her that. And I think normalizing that imperfection also made her feel, okay, everybody makes mistakes. So that becomes a demonstration of self-kindness. Then psychoeducating them about the concept that compassion is not an indulgence. So very often people feel when you're self-compassionate, you're being weak. But actually it's a strength that they can, that will foster growth and emotional balance. So maybe the person can be given some research, evidence to show that how self-compassion has helped others, and encourage the clients to tend and befriend their pain rather than suppressing it. So like I said before, self-compassion, when we include that in therapy, mindfulness has to be a part of it. And mindfully, when they are able to look at their own pain without judgment and not over-identifying with it, that's how they befriend the pain. And helping the client to hold themselves to be able to mindfully observe their emotion. I think what I just said. So if they can hold on to the feeling that shame is an expression of longing to be accepted and loved, and it's not something to feel so negative or condemn yourself. wanting to be loved and wanting to be accepted, it is a universal thing. All of us want it. And uh, the person who is feeling the shame also should not uh, feel bad about wanting that. So, a soothing touch. So, one of the things that is uh, very helpful is to place your hand on the chest and saying that this is a moment of suffering, and may I be kind to myself. So, this is called the uh, self compassion break. Whenever a person is going through something, a painful feeling, just to do this, just to take a few minutes to do this would be helpful. Next slide. So there are steps. I won't go into each one of them in detail, but psychoeducation about the concept and the research, like I said, would be important. Then exploration, I think we use a lot of CBT skills here to identify what is that inner critique and the voice of the inner critique and how that inner critique can be reframed. And practicing self-compassion break, like I just told you, and journaling about it. I think we'll come to each of them in a little more detail, and reflecting with the client, discussing how it felt, and normalizing resistance. I think very often we come across clients who feel that, if I'm compassionate, I'll become lazy and I'll not work on myself. So they have that fear. But you can show them that compassion helps you to grow, makes you feel more motivated to do things. So why would it make you lazy? The other thing they often come up with is, but if this voice is there within me, I think it's just a part of me. I can't change it. This is another resistance that comes up. So when they say that, you can tell them, yes, we don't have to erase the voice, but you can change the tone of the voice. You can reframe it in a different way. So overcoming resistance, this point is also quite important. And the home practice. So compassionate voice journaling and guided meditation, and one kind sentence to oneself every day at the end of the day. That also makes a difference. So I will take up each of these steps a little more in detail. Can we go to the next slide? So the most important thing is to recognize what shame makes them think or feel. So the first step is awareness and recognizing that inner critique, the voice. So it helps the clients to become aware of the tone, the language, and the function of their inner critique. So, for example, you could ask, when you feel you failed, what words do you hear in your mind? Whose voice does it sound like? And what does this voice believe it's helping you with? So when they are encouraged to journal these critical thoughts verbatim, somewhere they're able to externalize that this is the voice of someone else, which I'm trying to identify with completely and recognize the pattern. Next one. So the next step is to see the intention beneath. So this may not apply to all cases, but some cases it may be helpful. So viewing the critique as a misguided protector rather than an enemy. For example, the teacher who told Miss M, the one who went through bullying and comparison with teachers, the case that I mentioned earlier. So maybe the teacher thought that if she compared her with her parents, she would get more inspired to be better. Though her comments were harsh and they were not helpful at all, but the intention was different. Similarly, Hasina's father, who was so harsh, but actually he wanted to save her from getting ostracized in the community because they did belong to a very orthodox Muslim community. And he was afraid that they would point fingers at her and she will get a very bad name in the society and so on. So, though it was misguided, though it was badly done, the intention was there to do better for this. So, what the therapist could say is it sounds like your inner critique is trying to keep you safe, maybe from rejection or disappointment. Can we acknowledge its intention even if the method is harsh? So, reframing it reduces the shame and resistance. Can you go to the next one? So, this is the third step where cultivating a compassionate voice is the goal of that. So, how do we do this? So, it is with a two-voice dialogue. So, first the client writes down what the inner critic says. So, for example, Dr. Pallavi, the inner critic would be, I am a fake, I am not competent. So, we would ask the client also to write, how does the compassionate self react to this? So, something that she could say that, yes, I made a mistake this time, but I was under pressure and I am not a fake. I have treated many patients successfully and they're all grateful to me. So that is a compassionate voice. And asking the client to read out both of them. So another example is, you're so stupid to forget that. The compassionate voice can say, you made a mistake and that's okay. You've been under pressure. It happens to everyone. So this kind of practice is what is going to help. Next. So I'm just giving you a glimpse of all the techniques. So the two-chair technique has its roots in Gestalt therapy. I think we've been doing it for many years. But in this particular context of self-compassion, in the two-chair technique, we ask the client to sit in a chair and have an empty chair opposite. And first, the client talks like the inner critique, what the inner critique is saying. And then we ask the client to shift to the other chair and become the compassionate voice and be a wise mentor to or friend to this inner critique and talk to them in a compassionate way. Compassionate letter writing also may be helpful. Some people don't want to go through this and they prefer writing. And so, how do you write to a friend who is suffering shame? And what do you tell them is something that will be the content of the letter. And guided imagery. So, what we do here is allow the client to feel that they are in a safe place or with a safe person and make them go through this, show of kindness to whatever has happened. So it's like a supportive self within, which helps them to go through this pain. And soothing touch and breath, I already told you, holding your hand on the chest and breathing deeply and saying to yourself, may I be kind to myself. And what I found in my therapeutic work is eclectic approach seems to help the best because we can't hold on just to self-compassion alone. So my choice of technique would depend upon the issues that come up. So apart from mindfulness and CBT, I've often used family counseling, like I told you in Hasina's case, or even in Miss M's case, or the person with gay identity. I had to work a lot with the parents. and also liaising with other NGOs which help these communities. That was also an important part of, and advocating for them. I think all these, I think marginalized clients also need some advocacy from us. And so all these techniques are something that I would use for people who are undergoing the impact of shame. Next. So yes, I've put in the figure of Buddha there. I think he was the greatest teacher of compassion. I think we have learned so much from his philosophy and his teachings. So I think knowing compassion from the Buddhist angle is quite important. And like I said earlier, I think as a therapist, if we don't have a practice of how compassionate we can be to ourselves, I think it's going to be very difficult to convey that in therapy. So maybe it is also necessary to avoid compassion fatigue, to be aware that sometimes we can be fatigued by this. So what I think therapists should do is model gentle self-talk, even during sessions sometimes, because sometimes we are overwhelmed by the emotions that come up for the client. And we can say to the client as well as to ourselves that let's take a deep breath, and this is a tough topic. So saying that to yourself and taking a few minutes would help in managing yourself. And apart from this, within the session, but outside the session as well, I think we need to have the reflective practice of journaling what those moments have been in therapy, and what is our internal critic saying to us. Understanding that with empathy and authentically, that's important. And bringing compassionate awareness to therapeutic challenges and ruptures. So whenever we find something very challenging or we feel that we have made a mistake, how to be kind to ourselves. I think that sort of completes my talk. No, I have a summary, sorry. So as therapists, we witness the journeys of strife and struggles, courage and growth of our clients. And at the heart of it all lies the sense of self. Recognizing the attack on self caused by stigma, cultural oppression, etc., is a quintessential part of therapy. I think for the clients to know that they are not responsible, it was no fault of theirs that they were, there was this attack on their self, whether it is Hasina's case or whether it is, the girl who was traumatized by her teachers and school. All these cases, you will see that none of them were responsible for what happened. Without, they being at fault, they had to undergo this. So self-compassion provides an effective antidote to shame and transforming shame into courage and growth, which I saw in all these clients of mine. I end with this quote from Emerson: to be yourself in this world that is constantly trying to make you something else is the greatest accomplishment. Yes. Thank you so much. I was on time. It's okay. I completed.
Yes, ma'am, you were absolutely perfect. Thank you so much. That was a wonderful, uh, you know, presentation. I am so grateful for this talk. And the when you say that clients are our greatest teachers, right? It is your involvement in a client's healing journey. I think it is very evident in the way you dealt with how you went to their families, and like you tried your best to make them understand that to see things from a different lens, right? I think that's absolutely wonderful, and I think it is so nice to see that this is something that our participants can also take away, that their therapists can be people who can support them in that way. Thank you so much, ma'am. Thank you for your time. We are so grateful for your presence here,
Not
and
at
I
all. Thank you. Yeah.
I hope that you are there for the rest of our sessions as well, and you enjoy all the other talks as well.
Yes, I
And I
will.
hope you have a wonderful day ahead.
Thank you. Same to you. Yeah.
Thank you so much.
Bye.
Bye.